nobody would argue that China has transformed itself from a poor country with hundreds of millions of people living in poverty to the second largest economy and the largest trading nations in the world. China has done that because China has opened the world since later 70s, when the later Chinese leader Deng Xiaoping decided to adopt a market economy instead of socialist planning economies. Since then, China has made profound changes in almost every aspect of the societies. The living standard of Chinese people have improved dramatically. Over the past 3 decades, China has received a numerous of development grants, loans from multilateral and bilateral development agencies, such as World Bank, Asia Development Bank, development aid agencies in Japan, JICA, Department for International Development, UK. All these grants, loans, has helped China to develop its economies, as well as social development. Many of these loans and projects focus on the health development, particularly in poor areas. These projects, grants, have brought not only the financial resources, but also the technologies and expertise to China, which hugely benefit the peoples, particularly living in the poor rural areas. For example, I was the director of the resource center manager, responsible for technical assistant of the over $100 million project, aiming to improve access to essential health interventions in poor areas, which was jointly funded by World Bank and DFRD UK. That project aimed to help then the Minister of Health China to design and implement the health interventions. Fortunately, or unfortunately, China now is no longer qualified to receive these grants and loans from these multilateral organizations, bilateral organizations, simply because China is not poor now. China is a upper middle level income country based on its GDP per capita, according to World Bank's criteria. Instead, China has gradually become important donor countries. And China has now actively participated in global health governance while they increase their support to African countries and other Asian countries. So therefore, people would ask, what kind of role China could play in the areas of global health? What the Chinese unique experience could contribute the improvement of health for the world? First, let's look at what China has done so far in the past 6 decades. China has a long history of supporting small social countries, such as North Korea, Vietnam, as well as many African countries. China has sent hundreds of medical teams to over 50 African Asian countries. And China's doctors, thousands of doctors, treated millions and millions of African patients. China donated drugs, equipment. China have built hundreds of new hospitals, health facilities. In addition, China have provided scholarships for young people to come to China to study. China also have monies to do capacity buildings through short courses and workshops, etc. So China is unique ways to make a modest contribution to the improvement of health of the peoples around the world. However, China wanted to do more in the future. China wanted to play a bigger role, more significant roles in the areas of global health. First, let's look at, what China has done in recent years. Last September, in the UN assemblies, Chinese President Xi Jinping made an announcement that China would fully support implementation of sustainable development goals, not only in China, but also in other countries. China also made an announcement that in the next 5 years, Chinese government would allocate $2 billion to support the source cooperation program. In the next 15 years, China would like to allocate $12 billion to support that program. With this source cooperation program, China wanted to develop 600 projects. For example, 100 agriculture projects, 100 professional training program, 100 hospitals. So why 100 hospitals? I don't know. I guess Chinese government official also may not be able to answer those questions. Perhaps they just come up with the numbers that sounds great and nice, right? So while international communities welcome the China's source collaboration program with more monies, people would have to ask whether or not these kinds of initiatives or aid programs are really badly needed in Africa, or whether or not these kinds of health aid programs could be better designed and implemented in Africa's other lower income countries. One of my colleagues in Africa told me this kind of money could be better used to refurbish a regional hospital in African countries with better medical equipment, better medical devices, plus supporting in-services trainings, instead of building new hospitals. He might be right. He might be right. Having a new hospital in poor African countries without adequate resources, means the financing resources, the health workforce, may not be very helpful. So this all tells if the poorly designed, implemented aid project supported by China's source collaboration may not be helpful, even counterproductive. China's engagement in global health will grow substantially, significantly in the future. China would pursue its own unique approach. China would not copy Western countries. That's fine, but China should realize they have more to offer. For example, China could offer lots of good practice experiences in the areas of infectious disease control, maternal child health care, as China has made a huge achievement in these areas over the last 3 decades. For example, one of my colleagues, Professor Qian Xu from Fudan, sitting in this room, she has applied the Chinese experiences and lessons into Africa context. With the different support, she has done work in the Myanmar, in Ethiopia. So these kind of things China could do. So what we should tell the Chinese government, I think we health development practitioners, researchers, analysts should help the Chinese government to understand better to understand what kinds of needs African countries are required, what kinds of competitive advantages and what kind of unique experience China has got to make a real impact on improve of people's health living in these global villages. Thank you for your attention.